I'm David Mason, the Director of Public Health for the town of Sandwich, and usually you see me with Chief Burke doing our PSAs on Wednesday. As cases increase in the town of Sandwich, I felt the need to have the community or connect the community more with what's occurring, and I have had approached two individuals that had been positive and have had an experience that has brought them through some serious medical issues, and that they're still carrying some of those issues. And the first individual that I'll have is a young lady who's 25, and she will remain anonymous because of the type of work that she does, but she was more than willing to sit with me to talk about what occurred, how she contracted it, her feelings through the whole thing, and what she is experiencing now. And we'll have a gentleman in his late 50s, early 60s to speak to his experience. And I just think there's a need, because these two individuals are in our town and they're willing to sit with us and share their experience so that we can make it real. And I want you to understand what's occurring in town, what the public health nurse, Joanne Gake, and I see when we talk to these people and we have to knock on their door with these cases. And we're putting a face on what's going on right now. And I hope you can appreciate the presentation of this. I'm David Mason, the Director of Public Health for the town of Sandwich. Normally you see me doing a PSA weekly with Chief Burke, but with escalating numbers, I've been trying to continually think of how to message what's occurring with COVID and the impacts on the town. And one of the largest growing segments of the population is the 20 to 29-year-olds, in which we're seeing the greatest growth. They are the largest group. And it's been messaged over time that the virus doesn't impact your youth or your young adults, and that there is a quick recovery. And we're going to talk about that. We have a resident of town here who we're going to remain anonymous. Some people that have been infected prefer that to have that done, and that is fine. But I wanted to bring to you a real case. Because many times you see people talking in social media, they're asking, do you know someone that's infected? I don't know someone that's infected. And during this whole process, myself and Joanne Gake, the public health nurse, have been dealing with these people, and we have a face to these people. And I want to reach out to let the community know that this is occurring, it's real, and I want to talk about the impacts of it. So I want to thank you for coming and joining today to help with this project and to message to people in the younger community what's occurring. So, I'm familiar with your case, and Joanne Gake had worked with you also. And as far as when was it that, can you walk me through, when were you identified as being positive, in terms of time frame, and walk me through how that occurred?
I became positive about 6 weeks ago. I found out that I was positive about 5 weeks ago. There was about a week of time between when I became infected and when my test results came back that I was affected and that I was a positive case.
Okay, so and do you have any idea as far as what your exposure was for that? Are you aware of it? You don't have to speak to the specifics, but are you aware of it?
I believe it was in the car with someone who was a positive case.
Okay, so in that positive case at that time, were they asymptomatic?
They did not have symptoms.
Okay, so they were asymptomatic. So it's typical that we see, and again, this speaks to that young adult, that we're okay, it's not going to impact us. What was your feeling regarding the virus before you were infected?
I've always been extremely careful with the virus. I work with people who are immunocompressed, so I have a strong responsibility at my job to protect myself because I'm a vehicle for the virus and to keep other people safe.
Okay, no, that fair enough. So you have an awareness of it also.
Yes.
So, there is a populace out there. I mean, would you agree with me that in the young adult community that there is a feeling of, it's not a big deal. It's
Absolutely. I have, especially on social media, I have a lot of friends that I remember sitting there, in the hospital bed at the ER, gasping for breath, trying to distract myself. I'm scrolling through social media and I see people at, Halloween parties, and I just couldn't wrap my head around it.
So let's get to that, because I think that's important to know. So when you first were, what symptoms did you experience up front?
At 3 days after exposure, I started to have flu-like symptoms. So I had a headache, a runny nose, stuffy congestion, tightness sort of in my throat, almost kind of like strep, and a fever.
Okay, so is that what led you to going to get a test at that time?
Yes, it did.
Okay.
So on my third day, it was on the evening of my third day, I went to go to bed and it just sort of hit me like a train. I felt fine during that day. And around, after dinner time, all of a sudden I just felt terrible. So the whole next day I slept the whole day. I didn't get out of bed once. And then the day after, as soon as I was able to physically get out of bed, I went to be tested.
Okay. So, and then upon being tested, so once you'd mentioned as far as the timing, it took a while to get your test results back. And meanwhile, you're still experiencing these symptoms. What happened between that time and receiving your test results? What occurred?
So after about 3 to 4 days of cold flu-like symptoms, I started to feel a bit better. And I'll be honest, I was sort of guilty of that. Wow, maybe this isn't that bad. I did think that briefly. And I thought, that was terrible. I felt like I had a horrible flu. But I made it through it, and this must be the end of it. So by the time I got my test result, I was thinking, I probably have this, and it's probably not going to be that big of a deal. I must have gotten a mild case because I was able to get through it on the other side. That's what I was thinking, sort of around day 4.
About what day was that? I mean, as far as, they talk about the incubation period and then receiving, and then when if you start experiencing symptoms, there's so many days out. What day were you in?
So that would be around day 6. I started to feel like maybe I was out on the other side.
Okay. Because I think I know that as far as what we're experiencing here in town now is that you do see all of a sudden that day 6, that day 7, you think you're riding, you're kind of cruising along. Okay, I can handle this. And as you start going on, it starts affecting you more.
Absolutely. Days 7 and 8, or 7, 8, and 9, I would say were the worst for me.
So what occurred then?
I started to get this horrible shortness of breath. I felt like someone had put a bag of bricks right on my chest. I had to think about each breath. And I had pain in my chest when I inhaled. I had pain when I exhaled. I had to sleep completely straight up. We took a cushion from the couch, a really hard one, and put it behind my back, and I had to try to sleep sitting straight up because it was the only position that I could breathe in. When I would try to lay on my side, I physically couldn't inhale.
Okay, so that's a little scary there. And I didn't. How old are you?
I'm 25 years old.
25 years old. Okay.
And I'm an athlete. I'm healthy.
Okay, good to point out. So while you were going through that, and as far as, it must have been scary.
It was terrifying.
Okay.
It was.
So where'd it go from there?
So from there, I just kind of tried to push through it. And another terrifying thing about having COVID is you can't just go to your primary care doctor. You can't just walk into urgent care. You can't have a quick appointment to be seen, whether it's with a COVID-related issue or another issue. And so I also just felt scared that no doctor had seen me. I hadn't gotten medical attention, and I didn't know how to do that other than going to the emergency room. So on day 8, late that evening, I was trying to fall asleep, and all of a sudden I was just really gasping for air. I couldn't catch a breath. I took my inhaler. It didn't help. My doctor prescribed an inhaler when I was diagnosed. She called in an inhaler, and a friend picked it up and dropped it off.
Very good, because because I'm glad you clarified that, because there's a lot of talk about underlying conditions.
Right. So I had asthma as a child, very mild, but I haven't had an inhaler since I was maybe 5 years old, and even then I didn't use it often. So I was not a typical asthmatic or anything like
Yeah,
that.
because at the same time you were an athlete through your
Right.
high school age.
I was. So when my doctor even prescribed the inhaler, it's kind of like, I think I'm over this, but we'll pick it up. And I was really happy that I had it because I was taking it every 6 hours on the dot.
Yeah.
So eventually we reached the point that night where we called 911 because I didn't even think I could take the car ride over to the hospital, and I didn't want to put anyone in my family in the car with me.
So was the when you called 911, when the fire department arrived, were they prepared for you?
They were.
Okay.
They put one person in the back with me, and they explained usually they have 2 people in the back, but that they're only put one person in the back at a time to lessen the exposure to the EMS staff. The person looked like an astronaut in head-to-toe PPE. I was standing out my window watching them, kind of prepare for me to get into the vehicle.
It must have seemed like some sci-fi movie.
It did. It really did. And, once I was in the emergency room, I really had a moment of clarity in the emergency room when the doctor came in dressed head to toe PPE, absolutely hardcore. She was pregnant. And that really just said to me, my gosh, we have these healthcare heroes that are out there and people can't even be bothered to put a mask on. We have she was very pregnant, this very pregnant woman in here coming head to toe, and she would not be in there unless she absolutely had to be.
Right.
And I just really had this moment of clarity that, wow, this is extremely serious. I'd always taken it seriously, but having it myself really brought a new perspective.
Well, thank you for sharing that. That's impressive.
It was.
So so where'd it go from there as far as once were you admitted? I
was not admitted. I stayed for several hours. They did some IV bags. They said I was extremely dehydrated. I had a nasal cannula in my nose. They said that they weren't putting like high flow oxygen in because, I wasn't requiring high flow oxygen, but I did have a cannula in my nose, at least on the ambulance ride. They determined after they did a chest x-ray and said my chest x-ray looked okay, and that they felt comfortable to send me home, but they wanted me to have a pulse oximeter on my finger and said that if my oxygen went below 92 to immediately come back.
Okay.
So I was actually pretty surprised. It was extremely terrifying getting into the ambulance. I thought I was going to be admitted for sure, just based on the fact that I could not breathe.
Right.
And still, so I couldn't imagine people who have it worse than me, how terrible they must feel if I'm not even being admitted and I am in this horrible state.
So as far as, so you had a 2-week time, frame that you were dealing with multiple medical issues.
Yes.
And so so walk me through coming out of that, so how did that occur?
So I'm definitely not all the way out of the woods yet. Sitting here to do this interview is the most I've done in 6 weeks. It has been a really slow progress. Coming out of the 2 weeks of very bad symptoms, I have still been having heart palpitations, shortness of breath, carrying an inhaler, which my doctor said is because my body has been deconditioned. So these effects right now are just because so much was taken out of my body to fight this virus. And so now my body is just trying to get back to where it usually is.
Okay.
To be able to walk up and down flights of stairs, to be able to go through the grocery store without getting winded, to be able to bend down and, pick up a heavy box, to be able to do all of those things. Some other signs of stress in my body, my hair started falling out in chunks, which was horrifying, just in full chunks. And my doctor said that is hopefully reversible, but it's just a sign of significant stress to the body, and that it's actually not that rare of a symptom in women.
Really?
Yeah.
As in between, and prior to coming in, because you're wearing a mask, and it's been a number of weeks that you're out based on your isolation. That you still have a cough also.
I do, yeah.
So that you're
the cough earlier this week, 3 days ago, I coughed so hard that I actually vomited. That's how bad the cough is. I'm finally starting to get some of the mucus out that's been draining into my lungs for weeks now. but my cough, it's crippling. I had to pull over while I was driving here to cough.
So just, again, I just want to back up a little just to understand the time frame. So once you were in bed and you were able to remove yourself from bed, how long of a time have we been talking right now?
I would say that I was laying down in bed for probably 3 weeks.
Okay. So, and then you've been up and about how many weeks now?
I've been sort of up and about for 3 weeks, out of isolation, but very limited on what I can do. I've been trying to go out and take like a 20-minute walk at a time or something. The other day I tried to go grocery shopping. I got so winded that I almost passed out in the store and had to go to the car. So I'm kind of learning what my boundaries are, and it's sobering.
As far as we had talked also about, there was what brought this idea to me. One is the idea that people in social media are saying, I don't know someone that has this, it's not that big of a deal, it's just the flu. And there was an episode on 60 Minutes that talked about long haulers, as far as, and you had said you had seen that, and that's what brought to my attention as far as how do we share what's going on so people can somehow relate. I had said to you, it's like taking, people want to take this risk, and it's like taking a bag of M&Ms, labeling 4 of them as poison. Are you willing to take that risk? And I'm trying to share what your experience is to make people think, do I really want to take the risk? And I think as far as, you saw that episode of the 60 Minutes regarding long haulers. I mean, how did that leave you? What did you think? What did you come away with that?
It terrified me. It did, because I sort of wake up each day and I think, is this what my life is now? Am I going to get better? I make some progress for a few days, and then I'll have a day where the whole day I'm just sitting inches from my humidifier trying to breathe in Vicks, and I'm still having a hard time catching a breath. And the day before I was able to walk for 30 minutes, and then the next day I can't. So it's really terrifying.
So if you had a room full of young adults and teenagers, as far as,
I wouldn't put a room of young adults in the room together.
Understood. But if you had an audience,
yeah.
What would you share with them?
The importance of wearing a mask, of staying home, of not having large indoor gatherings. When I got the call that I was positive, I was terrified because of the people of my family. But luckily, I'd only been around 3 people. My partner, my 2 parents. And those are the only people we really had to worry about. But I imagined that I was positive sort of over Halloween. And I thought, what if I had gone to a Halloween party? All my friends are posting photos of Halloween parties.
Yes,
if I had been there,
you had mentioned that you're watching social media. So.
I would have infected everyone in the room. And so as horrifying as it was to know that my parents and my partner were potentially at risk, at least it was only 3 people. I can't imagine if this had happened over Thanksgiving and I had gone somewhere. Thanksgiving was my partner and I in our condo.
Right.
So it's terrifying.
Well, I want to thank you for sharing your story. I appreciate it. And Joanne had said you were an excellent patient. We always talk about if we had an award that we would give out to patients through this whole thing, we have some names that we keep running as far as that you were very cooperative and very understanding of what we needed to do also, and the importance of that. And I'm sorry that you're experiencing that. And but I'm thankful that you were able to share it with the community.
Also do want to testify the importance and reiterate the importance of wearing a mask. We live in a very small 2-bedroom condo, and wearing a mask that whole time, bleaching the shower after I used it, using paper utensils and paper plates. My partner didn't catch this.
That's a great message, and I want to thank you with that. And anything else you want to share?
I think that's all.
Okay, well, thank you again.
You're welcome.
So.